Okay, it looks like we're live now. All right, thank you so much. Welcome to another Prisma Health Facebook Live, and thank you for joining us. I'm Rebecca Munnerlin with the Media Relations team at Prisma Health. Signs of spring are everywhere in South Carolina, so along with flowers and pollen, you may have noticed sneezing, wheezing, and scratchy eyes. And today we have two Prisma Health experts for some advice on how to cope with those seasonal allergies. First, I'd like to welcome Dr. John Pulcini, an allergy and immunology specialist based in Greenville. And also we have with us Dr. Kayla LaFaver, an internal medicine specialist based in Lexington. We're glad to be joined by our local media partners and social media viewers who are invited to post questions in the online comments, and we will get to as many of those additional questions as we can. Dr. Pulcini, I'll start with you. If you'll help us understand what allergy means and what are some signs that you may have seasonal allergies.
Sure, that's a great question. So allergy just means that you're having an allergic reaction to a substance. So someone can be allergic to many things. You could be allergic to, medicines or foods or cosmetics. Certainly today we're talking about allergic reactions to pollens that such as spring right now with tree pollen being very high, or later in the spring or summer where we'd have grass pollen. And some signs you might have seasonal allergies would be, runny nose or congestion or itchy eyes or recurrent throat clearing. And those would be some of the most common things.
Great. Thank you for that. We're going to switch over to Dr. LaFaver now. And my question is, at what age do many people begin to discover that they may have seasonal allergies?
A good question. So typically it takes a couple of years into life until people develop sensitivities to allergens. So usually we'll start seeing seasonal allergies anywhere from 2 to 5 years old. And then that peaks again in early adulthood as well. So
thank you for that. I always wondered if it takes some folks a little bit longer to develop those. And on that topic, changing back over to Dr. Pulcini, do you often have patients who are new to the region who are surprised to experience allergies for the first time?
Yes, it's quite common where someone will say, we've moved to South Carolina and I used to not have allergies, but after a year or two, they start having significant symptoms. The way the immune system works, it's very common where someone becomes sensitized. So all this wonderful, beautiful area of the country where we have all these different types of trees and grasses can be beautiful, but they certainly can sensitize or make someone become allergic after, just a couple of years.
Dr. LaFaver, as we were talking about at what age you may develop those symptoms and signs that you might be having trouble, are there differences in how allergies affect children versus adults?
There are a few. Seasonal or environmental allergies can present similarly to itchy, watery eyes, sneezing, congestion. Food allergies are more common in kiddos. So you might see in kiddos reactions tend to be more severe in onset initially because they haven't been exposed to those allergens before. So particularly food allergies can sometimes be quite violent reactions in terms of nausea, vomiting. Anaphylactic reactions can be severe, shortness of breath and trouble breathing. But overall, and again, that sensitivity happens at 2 to 5 years old, and then again early adulthood, typically in your 25-35 age range.
That's helpful. Dr. Pulcini, besides spring pollen, what are some of the other most common allergens that trouble patients, particularly, and I guess we're speaking environmentally, particularly in the Southeast region?
Yeah, so in the Southeast region, typically this time of year, March to May will be your tree pollen. And that's why we have all these trees showing up right now. Right after that, we get grass pollen. So usually right around April or May till mid-July, when everything kind of dries up and is dead, then we'll have a grass pollen. Then we have a very little reprieve for a little while before August, once school starts, and then we have ragweed and runs all the way right through until the first frost. So we have a lot of pollens in this area, and so it's trees in the spring, grass in the summer, and then weeds in the fall.
Yeah, that sounds about right. I think so many of us experience these. It's really a topic of conversation right now.
It is.
Dr. LaFaver, when should someone consider seeing a doctor or a specialist about their allergy symptoms?
Of course, yeah. If your symptoms are particularly severe for shortness of breath, nausea, vomiting, I would certainly seek out your physician or a specialist. Of course, if your symptoms are worsening despite some over-the-counter therapies, antihistamines, nasal sprays, despite those, then I would definitely seek out your provider.
That's a great lead into my next question for you, Dr. LaFaver, which is if we watch folks who are watching television and even listening to radio ads and whatnot, we hear a lot of advertising for a good many over-the-counter medicines for allergies. And I was wondering, are they all pretty similar? And do you recommend any in particular, especially for seasonal allergies?
Absolutely. Good question. Now, all of these second generation antihistamines, Zyrtec, Claritin, Allegra, have similar efficacy. The nasal sprays, particularly Flonase, which is a glucocorticoid steroid nasal spray, can be particularly helpful. So one of those three antihistamines plus a nasal spray is usually my go-to recommendation.
On that same topic, it seems to me that most of these medicines are designed to be taken as a preventive before you're exposed. Is that correct? Or is it okay to take them after you're already having trouble? Like if you start to have an allergy attack because you've inhaled some, I don't know, green grass pollens or whatever that you've just come across.
Yeah, so if you know of a particular allergen that you're sensitive to, taking those medications 2 to 3 days before can be helpful. But the nasal sprays particularly can be helpful during an acute flare episode as well.
Gotcha. Dr. Pulcini, let's talk a little bit about allergy shots. How do those work?
Sure. Yeah. So allergy shots are also known as desensitization. It involves giving the patient a little bit of what they're allergic to over time to kind of change their immune system, to take, a 10, 20, 30-year-old or even older with allergies to a patient with much less. So it's something that involves coming weekly to usually an allergy office to receive the injection. For a lot of patients, it makes a big difference, but it does take a while. It's not an immediate change. It takes, a few weeks or months to really reach the maintenance. And then once you're at maintenance, then we can space you out. For patients who are not getting better with, medications or avoidance, it's very helpful, but it does have risk. There can be risk to, the patient, which is just redness or swelling at the site of the shot. But it can go all the way up to anaphylaxis, which is a life-threatening allergic reaction. So these are things that have to be given in an allergy office. You have to have, the patient has to wait 30 minutes after the shot. But for a lot of patients who can't get better with medicines, they can't access them, or they have side effects, it makes a tremendous benefit on their quality of life.
It's great. Do you feel like those have gotten even more advanced over the years? I know even when I was a kid, we took allergy shots back then. Have they changed much?
Yeah, they have. We've been able to identify the specific major allergens for certain different pollens and different antigens. And so they can be given more safely. And so we're able to give it, like I said, as young as 5. I have people in their 70s, pregnant women everywhere in between. And for the right patient, it can really make a significant difference. There are also allergy tablets, which are FDA approved. Those are things that can be given in an allergy office. And then after that, they can be given at home. And any provider can prescribe those. Unfortunately, they're only approved for a couple things. It's only grass, dust mite, and ragweed. So the majority of patients who need immunotherapy will often need allergy shots, because then you can put in molds and animal danders and things. But for a lot of patients, it makes a big difference.
It's great to have options. That's amazing that it's advanced that much. Um, Changing back over to Dr. LaFaver, and again, speaking from personal experience, I've noticed that some of my childhood allergies are much less severe as I've gotten older. Is that very common?
Yeah, I'll say allergies change with age. It is common to some degree as we age. Our immune system, becomes not what it used to be. So you can have less and less of a response to certain allergies. But as Dr. Pulcini was referring to earlier, some allergies will actually worsen up until about age 50 or 60, well into adulthood, due to that sensitization he was referring to early, where it takes less and less of a particular allergen to elicit an allergic response. So they change, but certainly as we get later and later into adulthood, our immune system is not what it used to be.
Gotcha. Well, that makes sense. Dr. Pulcini, what about taking any supplements? I remember my grandmother used to talk about taking bee pollen, and does that help? And is there anything we can do to make our indoor environments a little more of a sanctuary from allergy attacks?
So so local honey is something that I think is recommended by some patients to be helpful for their overall health, and certainly it does have some components that it can be helpful. Unfortunately, it has not been helpful or shown in studies to be helpful for allergies, particularly pollen allergies, mostly because the majority of the pollens that are actually problematic for patients are wind pollinators. They're not flowering plants. And so usually your bee pollen are going to be your flowering plants. And your big problems right now are these kind of oak trees and maple trees and things where, they're wind pollinators. So in and of itself, the theory is that if you took a little bit of pollen, took a little bit of honey, it may have had a little bit of the pollen on there and may give you that desensitization. But again, it's not related because it's not the right type of antigens or allergens, and it just hasn't been shown to be helpful. If you wanted to do stuff to kind of reduce your pollen allergy, certainly there are things you can do, like you could wear a mask when the pollen is very high. You could wash your face, a couple times a day. You could follow pollen counts on your phone, on the news. To be honest, you can look at your car. If your car is really green, you're going to have to, do a little bit more that day. Something that a lot of patients forget is, keeping their windows closed and the air conditioner on recirculate, but also bathing your pet, because your pet may go out and track things in, can really be a much more problematic issue than people think about.
That makes sense. Sticking with that a little bit, how about patients who have other chronic health conditions like asthma? Are the seasonal allergies more concerning for them?
Certainly, yeah. So there's kind of the one airway hypothesis. So once you take stuff in through your nose and your mouth, it can go down through the rest of your airway down into your lungs, and so it certainly can trigger an asthma attack. And so you'll see patients who will start saying, "I'm having to use my rescue inhaler more. I can't run as often or as far," and so they may have to work indoors or work out indoors during that time. Not all asthma triggers because of allergies. Certainly, can be cold air, exercise, or infection. But a lot of patients who have seasonal allergies also have allergic asthma, and so you'll see a lot of allergic triggers for asthma during the fall and spring.
Thanks for that. That's good to know. We did have one question from one of our media partners. They were saying, Dr. Pulcini, you mentioned allergy tablets when you were talking about shots as a new limited option for certain types of allergies. Carrie Beal was wondering how the allergy tablets are different from over-the-counter medications, and wondering if you can explain that a little bit more.
Sure. So your over-the-counter medications, just like Dr. LaFaver explained, are really good about controlling symptoms. So we have antihistamines to help with sneezing and itchy eyes. We have nasal sprays, which help with congestion and drainage, but they will help with symptoms. Whereas with allergy tablets, you're actually giving the patient an antigen, again, to make them less allergic. Just like you would be giving allergy shots, you're just using the sublingual immune system instead of the subcutaneous or a shot. The tablets are purified antigen or purified allergen. So the grass tablet is a grass antigen. The ragweed is ragweed. The dust mite is a dust mite. And the patient would come into the office and they would have to put it under their tongue. They can't swallow for a minute. They can't drink for a few minutes. And then we watch them for 30 minutes. And as long as they have no reaction, then they would go home and they would take that either, starting 2 or 3 months before that season, or and then during the entire season, and then they can potentially stop. Or some patients will take it year round, particularly for dust mite, which in our area of the country is almost year round. The way I describe it for patients to try to make it simple is both allergy tablets and allergy shots will help you. Allergy tablets are like having a home gym. Allergy shots are like going to the gym. An allergy shot, you've got to drive to the office. You've got to, wait the 30 minutes. There's a risk of reaction, but you'll probably, get better because there's different antigens we can put in there. Kind of like working out. You'll have, maybe a personal trainer. You'll have different workout equipment. That's where allergy shots work. Allergy tablets are having like a home gym. You'll still probably lose, weight, gain muscle mass. You can work out, by yourself and things, but you probably won't push yourself as much. That's where the tablets work. But for patients who can't come in for shots or have significant needle phobia because it's a tablet, or are particularly just sensitized to just dust mite or grass, it can make a big difference for them.
So essentially in both cases, it's being exposed to a small amount of that antigen to build up your resistance, to build up your ability to resist the negative impacts of those things when you're exposed to them.
Correct. It's helping you build up tolerance. Exactly.
Got it. Recently, the Allergy and Asthma Foundation of America ranked Greenville as number 10 on the list of the 100 worst cities for allergies. And Columbia ranked 33rd, and Charleston, a little closer to the ocean, was 51st. So we are definitely in allergic territory around here in South Carolina. And I would like to mention that today we focused more on seasonal allergies, but we know people deal with many types of allergies related to foods or other things they come into contact to in their daily lives. And so I wanted to ask both of you, if someone wants to learn more about allergies and treatments, where would you suggest they do a little research, or where should they look? And Dr. Pulcini, you want to take that first?
Sure. So, we have two national organizations, the American College of Allergy, Asthma, and Immunology, and the American Academy of Allergy, Asthma, and Immunology. And both of them have great patient information on their websites that are the public versions. And I think that would be a good first place for our patients to really learn about their symptoms and what maybe options they may have for therapy.
Yeah, I definitely second Dr. Pulcini. I send my patients to those two resources as well quite frequently. There's wonderful patient information there.
Perfect. And of course, folks should know they can come to you, their primary care doctors. And then if I suppose if they need, in some cases, you might refer Dr. LaFaver patients over to specialists like Dr. Pulcini if they need a little bit more intensive investigation of what they're allergic to.
Absolutely.
Well, thank you so much. I think that is all of our questions for today. Are there any other parting thoughts you'd like to leave us with, Dr. LaFaver?
No, I just, I encourage you to seek out your primary care provider first and foremost. If, again, your symptoms are worsening or not controlled with over-the-counter antihistamines and nasal sprays, it is very common, as you alluded to, in this area, and definitely worth seeking out a conversation with your primary care provider.
Thanks so much. And Dr. Pulcini, I'll give you the last word. Thank you again.
Sure. No, I just agree with my colleague. This is something that, a patient can start with just themselves. And then from there, if they're still having trouble, can move on and see a specialist if necessary.
Perfect. Well, thank you everyone for joining us today, especially our experts for giving us a few tips on how to get through this seasonal stuff we're dealing with right now, and then some things that'll get us through the rest of the year too, because I think a lot of us have our ups and downs throughout the year depending on what's blowing in the breeze. So thank you all so much, and I hope you're enjoying a great spring.
Thank you so much for having us.
Yes, thank you.
All right, thanks. Bye-bye.